POLST is important because it enables us to preserve patient preferences at the end of life as an actionable order that's recorded in the patient record and can be accessed by healthcare professionals across settings. This study is important because end-of-life care is a realm of medicine in particular where quality outcomes depend heavily on whether the terms of medical care are dictated by patient preferences. And we know that goals of care conversations are best performed between patients and healthcare providers that know them best. And within the POLST program nationally, there are debates around whether nurse practitioners should be allowed to sign POLST forms. And so this research looked at data from Oregon, a state that has allowed nurse practitioners to sign since very early in its program, to analyze what proportion of forms are signed by nurse practitioners and what impact nationally it could have on patient-centered care to not allow nurse practitioners to sign POLST forms. Within the state of Oregon, a state that has allowed nurse practitioners to sign POLST forms since very early on in its program, about 10% or almost 25,000 forms have been signed by nurse practitioners. Some states do not allow nurse practitioners to sign POLST forms for a variety of reasons, but in conversations with POLST program directors from those states, a common barrier to passing legislation that allows nurse practitioners to sign actually comes from state medical associations.
Sophia Hayes is a third-year medical student. She led this project and really represents the future of healthcare. The future of healthcare is in teams, having us work closely together to serve the best interests of patients. Sometimes nurse practitioners are the very best person because they're the primary care professional caring for that patient and know them best. Or they have special skills and training in talking to people near the end of life and serve on a palliative care team. It is a shame when patients and families so often make these decisions near the end of life that we don't put all possible skilled professionals to the task. That we keep people away in some states who could serve these families very near the end of life when they choose to make these decisions. Over half of people complete POLST forms within the last 2 months of life. It means we need to be nimble, we need to work together, and we need to move quickly to serve patients and families when they're ready to talk about what they want most in life's last chapter. And often it's to put together a plan that allows them to be at home with family. That means filling out a POLST form and talking about the things they do and don't want. And it also means making a plan for the care they will receive so they can stay at home.